Hey everyone, I wanted to take a minute to just give everybody a quick update for how this week went and how everything is going with Leo. So Wednesday we had our first sort of like regularly scheduled MCA scan, and overall just ultrasound looking at, his heart and everything. And that went really well. So his heart is looking significantly better. It's still just a little bit thick, but other than that, cardiac function is almost 100% normal, which is huge from where we were just 2 weeks ago. And the fluid is still completely cleared up, so no high drops, which is also really exciting. And his MCA scan, so that's the vein in the brain, came in at 1.49, so just under the anemic line. Again, normal is 1, anemic is 1.5, so he was 1.49 MOMs. And so because he was like just under that, our doctor didn't want to wait a full week till the next scan, so we're going to go back on Monday to have the next scan. I'm assuming he'll probably be just over the anemic line, which would cause us to then do the next transfusion on Tuesday, which is just a couple days earlier than we had originally planned on the next one being anyways. So I also wanted to talk about why they do it this way, like why they check that weekly and why they wouldn't just go in and transfuse if he was that close. And that's just because every procedure is risky, right? Like our third one, I was put completely under and we almost went into an emergency C-section. There's always that risk there when you are putting a needle in and doing the transfusion. So you certainly don't want to do the transfusion if the baby doesn't need it. So you kind of like want to get to this place where they're anemic, so that red blood cell count percent, sort of comes down to like the 20s so that they can put them back up to 40, because you don't want to go in and find them at 35 and you didn't actually need to be in the OR. You didn't have to have a needle in the mom's stomach. You didn't have to have that risk. So you kind of want them to be in that 20s range, so that they really need the surgery. But you also don't want them, obviously, to get extremely anemic where they're having the fluid and everything again and their heart is in danger. So it's this very delicate balance, and the best tool that they have for that is these MCA scans. So as long as the MCA scan is under 1.5, then they're not anemic, meaning they wouldn't need a transfusion that day. And so you don't want to go in unless they need it. So they kind of just use that to track. And if it's over that 1.5, then they're probably in that 20s range where they would need to go in. I also learned that when babies need transfusions like Leo does, and, as they grow, they need more blood. And as their body tries to producing blood, my antibodies will continue attacking, which is why you have to go in, every 2 or 3 weeks. The other sort of marker other than the MCA scan to know if they're anemic or not is that they sort of expect that percent to come down about 1% per day. So that's where that cadence kind of comes from, with that every 3 weeks is where they're expecting them to be in those sort of low 20s so that you can get them back up to 40 each time you do the procedure. But then they do the weekly MCA scans just to make sure that nothing like plummeted and they're anemic before they're expected to be. So it's just crazy what they're able to do and how they're able to track these things. I've been listening to a lot of the Allo podcast, which does a lot of educating on this entire condition, the maternal alloimmunization, which is what I have, and the HDFN, the hemolytic disease of the fetus and newborn, which is what he has. And like the history of it and where it's currently at and in the future and everything. And it's just crazy to learn about like what they used to have to do. But it's also really exciting because they have, hope for the future on not even having to do these intrauterine treatments down the road when they can continue the advancement of this. So it's just been really interesting to learn about that. And there's also a lot of other stories of other moms that have gone through it. And it's really just great to hear from them and just feel that like connection to them. It's also been really emotional listening to some of these moms' stories because quite a few of them lose a child before they learn the proper care that they needed, and then they're able to find the proper care and advocate properly to have living babies. Because it's a rare disease, not a lot of doctors actually properly know how to treat it or properly know how to monitor it. And so the Allo Hope Foundation is all about like getting the word out there and making sure that people are educated, patients and doctors. And it's also just emotional to learn about like a lot of the babies that are as sick as he was just 2.5 weeks ago don't make it. And he has come through to the other side of that. And it's very humbling, and I'm just filled with gratitude. And it's also just like emotional to think about like how close we were to the possibility of losing him. And I'm just like, it's just heavy on my heart. Also, today is Saturday, September 30th. And today was our due date for the baby that we lost in February. And so that's heavy on my mind today. But also just like a complicated emotion because, you know, if we didn't lose that baby, we wouldn't have him. And it's just, there's a lot of feelings today. So anyway, that's all I wanted to share. Pretty short and sweet today. We go back in on Monday for our next scan. And like I said, I'm assuming he'll probably be over the anemic line Monday. So we'll go into transfuse Tuesday. And then I'll update you guys after that. So thanks for continuing to follow along. And I hope this is helpful. Bye.